Okay. I'm Virgil Renzulli. I've been either in touch with you directly or indirectly over the last few weeks and months. I want to go over just the basics of this. First of all, this is a one large conversation that will be moderated by Dr. Jarrell. And, it's confusing enough doing these on Zoom. And so rather than try to do introductions in the beginning, what I would ask is the first time you speak, whether you're asking a question or answering a question, just give your name and your affiliation. And of course, we will have those names under your pictures. Everything is on the record, and we will make a recording of this. And so if anybody would like a recording, we'd be glad to supply that as soon as it's ready. We ask you to keep your questions and answers brief and to try to advance the conversation and not reiterate a point that's already been made or give a better example of it. Let me get down to the two technical things, and this can be a little confusing. In order to sequence the comments so that we exhaust one topic before moving on to another, if you wish to speak, whether you're one of our experts and want to respond to a question or a journalist who wants to ask one, please use your chat function at the bottom of your screen and send a message to Monica Mangione. Now, she will, and don't write out the question, don't write out the answer, just indicate, are you responding to the topic that's currently under discussion, weighing in on the current topic? Do you want to broach a new topic? If you're a journalist, do you have a follow-up question, or do you have a question on a new topic? And that way she can put them in sequence, give them to Dr. Jarrell, and it shall be orderly. I've done this about 5 times. It actually does work. Any questions in that part? Okay. Well, then let me again say there are over 20 panelists. There are several of you who have not activated your camera. There are several of you that haven't, there's at least one who hasn't activated anything, so we don't know what it is. And there's one panelist that hasn't changed the designation panelist to add a name. So the way you add your name is to put your cursor over the picture. Upper right-hand corner, there are 3 dots. Click on the dots. You'll see something that says change name, and you can put your name in so we'll know who is speaking. Are there any questions? Well, if not, let me turn you over to your host and moderator, Dr. Bruce Jarrell, who's president of the University of Maryland in Baltimore.
Thank you, Virgil. I'd like to welcome everyone here. I am president of the University of Maryland, Baltimore, but also a transplant surgeon by specialty. And those of you who don't know UMB, it's a special focus university with 6 professional schools, 4 health sciences, law, social work, and a graduate school. And we're associated with an academic health center, the University of Maryland Medical System. When Virgil and I first met and then started talking about the pandemic, one important story seemed to be missing to me, and that was what had our academic health centers been up to during COVID. And as I thought about this, I really had a single answer, and that was we hit the accelerator, we floored it, because most of us went into double and triple time. And I'm sure that pretty much everyone on this call would agree that that's what happened at their institution. I was a brand new president at the time it hit, and I have to tell you, it was a steep learning curve. But I thought maybe to kick this off, I would mention a couple of things that I thought were very important at a high level about the pandemic and what our guests, the journalists, might want to ask questions about. And I would start with one of these things that everybody knows, and that is that academic health centers and universities are not nimble and they're not able to quickly evolve. But I have to say that we proved very different during this pandemic, and we're able to change in a big way. One remarkable way that we changed, and I don't know that we were unique in this, is we took a state university and a private medical center and merged them under a unified command so that one individual was managing all of their resources across the university and the medical center. It was highly coordinated. It was very efficient. It covered most of the state. In the process, we converted our academic health center to one great big ICU and clinical research unit. COVID started quickly here like it did with you, and we were the safety net, so we got the sickest of the sick, but we're very prepared because of this unified command. The same was true with vaccination. When they became available, we were very ready to do that. And many of you may or may not know, but UMB has a very well-established Center for Vaccine Development. And we were one of the first of 2 universities in the US to begin the Pfizer mRNA trial in May of 2020, closely followed by the Moderna trial. I was in the Moderna trial as one of the initial subjects. I remain in that trial after the second booster. So it's been an important thing around here. And if anything, vaccine trials have been a way of life at UMB for many years. We continue to invest in this. And one of the net effects was the development of a number of recognized experts on our campus. Not only did they lead vaccine trials, but they advised the governor of Maryland in very detailed manners. And I'm happy to say he listened. We advised the White House, the World Health Organization, the CDC, the FDA, and had a lot of communication with the public on TV, on videos, et cetera. And they were remarkable leaders in this process and always available. One other thing that we did, which I think others did as well, is we converted a major, very well-funded research lab into a clinical lab to do PCR testing for COVID. This was a tour de force. It took a huge amount of energy, but yet allowed us to serve the state with over 1 million tests, and our fellow universities allowing us to test their students to stay in session. This happened very fast, and it was not typical of a university. And so I think as a result of that, we saved lives. But I might say as a surgeon, that's what I would expect out of an academic health center, that we respond to this kind of emergency. So what are the things that I saw, that I found, that I did not expect to find during this entire thing? And I would start with a simple thing, and that was that COVID was an unbelievably rapid accelerant for leadership development. And during this process, unexpected leaders stepped forward at all levels of the organization: students, faculty, staff. They took initiative, they took risks, and they got results. A remarkable thing for people who had not been in leadership roles. And it was this individual initiative combined with our unified command that really carried the day. And if I were to describe it to the group here, I would say we developed a team of leaders, which is not something we had had before. And it was a team of leaders working together. To me, it was a great advantage because I had the privilege of listening to many voices, many points of view, many leaders who were not only engaged, but empowered to speak out. So it didn't matter what their role was in the university. They had direct access to the president and the CEO of the medical center. It's helped me immensely in terms of managing this organization. And helped guide me through uncharted territory. And I suspect all of you were in the same category. Most importantly, it helped me to see things that I might have forgotten to consider. And as a result of that, students graduated on time. Research projects continued for our graduate students. Our research proposals, awards, and publications grew in an unbelievable way. But the most important thing, and I think for me, one of the key things, was traditional silos in our academic health center all but disappeared. Suddenly we were on the same team. Suddenly our commitment to common core values and collaboration became alive, and it has stayed alive. So I would say that we've been very focused but broad-minded, and we have fundamentally changed in that way. There's one other fundamental change I'd like to bring up with everyone before we go to the discussion. There was one other important accelerant to one other mission, our community engagement mission. And I know every one of us on this call heard media reports about how distrustful the underserved population was about the medical establishment. And I have no doubt about the truth of this. But I will tell you also that when I walked across Martin Luther King Jr. Boulevard to our West Baltimore community, I also saw something else. And that something else was wherever we had developed well-developed, long-standing community programs, there was trust. And where there was trust, as soon as the vaccine was available, the citizens lined up ready for vaccination. Now, that trust took years to develop, but I have to say it was robust, it was solid, and it made people's lives better. So I learned something from that, because even though that was our mission, I learned that we couldn't do proper COVID prevention, COVID treatment, et cetera, without a proper and durable community engagement program. It was just as important as our other missions, which made us part of the community, not just some big nearby institution. So I'd like to close with a final observation, and that is, as terrible as COVID has been, and we all know it has been, there have been many positives, and I've seen them in our academic health center. We have made huge advances in science, both the prevention and the treatment of this disease and understanding the molecular mechanisms. I think we are more prepared than yesterday for another health crisis, but I think we've learned something much deeper than just the scientific part. We have learned to put together highly functional teams that collaborate. We've learned how to do that efficiently. And we've learned the high importance of building trust with our community. But of course, we've also learned that we've got much more to do in that arena, pandemic or not. So I hope in this upcoming conversation, we'll be able to bring out the best lessons that all of you have learned and more that I have learned, so that we can advance our knowledge and effectiveness and let our guests know about the many activities that our universities were deeply involved. So I want to thank my colleagues for being here today. Please feel free to supplement what I've said, but give your own thoughts. And I hope that the members of the media are ready for some lively conversation. I think, Virgil, you've explained how to ask a question and who wants to respond. So with that, I will stop and hand it back over to you. We got to start with a question, right, Virgil?
Yeah, we should, yes.
So any of our guests have a question they'd like to put on the table?
Jane?
Sorry, I couldn't find my chat there for a second. Well, it's what your opening remarks are oddly, in a way, close to the question I was thinking of asking to start us off, which was, you know, we have heard so many stories about, you know, the painful and downside for education across the spectrum during the pandemic. But I was wondering if you had to pick, aside from the medical aspect, but otherwise, if you had to pick one, the most radical change that has occurred over the last couple of years, you know, for the better across the educational field, you know, what would that be?
Who'd like to start on that one?
Okay, let's do this.
Linda would like to respond.
Hi, I'm Linda Freed. I'm the Dean at Columbia University's Mailman School of Public Health, and I'm an internist, geriatrician, and epidemiologist. I would say, actually, from the point of view of School of Public Health, the really positive outcome of the pandemic is that our nation, if not the world, now understands that public health is a critical societal investment, that we need it at its best, that we have disinvested in it for 60 years in the United States, and we've reaped the consequences in this pandemic of that disinvestment. And potential students are realizing what an important field this is, and I think all schools and programs of public health have seen this uptick in applicants because of these realizations, both that we need to invest not just in trust, but we have to invest in creating healthy populations so they're less vulnerable. And that's the role of public health. And we need to invest in preparedness for the kinds of emergencies which are escalating, like pandemics. And the students get it.
Okay, I think we have Dean Dalglish.
Thank you. I am Lucy Dalglish. I'm the Dean of the Philip Merrill College of Journalism at the University of Maryland in College Park. And the College Park and Baltimore campuses are not really under one umbrella, but we work together in many ways and share a research vice president. Immediately after, things really struck for us right before spring break. And from my standpoint, it was an incredible team building exercise under the leadership of our former provost, who found someone who was an outstanding educator and an outstanding IT person. And under his leadership, we were able to get in 2 weeks everything we did online, and we were teaching online really well. And I think one of the lessons I learned was that if you come up with a pretty modest financial incentive, teachers will produce. What happened was everybody who was interested in a teaching innovation grant was able to apply to get roughly an average of $5,000 per faculty member to come up with new ways to teach online. And they were all very, very enthused. They thought we'd maybe get 30 or 40 of these grants. We ended up with more than 250. And it was millions of dollars paid out to the faculty who did remarkable things using innovative online techniques. So our teaching mission, of course, wasn't perfect, but we were able to keep going. And in the long run, what we learned from all of this is what works well online and what doesn't. And so a handful of our courses we're going to keep teaching online, and the rest we're pretty much back to business as usual. But from my perspective, the first 6 or 8 months of the pandemic in particular were an amazing exercise in teamwork.
Dean Bowman.
Hi, my name is DuBois Bowman, Dean of the School of Public Health at the University of Michigan. And by training, I am a biostatistician. And, as I think about the window preceding COVID, all of our faculty, our staff, our students, everyone was saturated with work. So one of the things that I really admire that happened as a consequence of COVID is how many faculty in particular pivoted in terms of their research programs and really stepped in, to address an important societal need, and really to gauge their activities based on the potential for impact. And this came through in a number of ways that really reinforce and illustrate many of the things that Bruce Jarrell started out with, of multi-sector collaborations, working across government, with the private sector, academic leaders, lending the expertise to try to determine a path forward at a time where there was so much unknown. And so I think about the immediate need to build up infrastructure and operations to continue to run the university or externally to run businesses, but then also just the need to establish knowledge to inform and guide our decision making. And there was so much of a gap at that time. And so things that come to mind for me, or research done by faculty just on basic mode and mechanisms of spread of COVID, and thinking about air sampling or surface sampling and wastewater. All of that is knowledge that we didn't have at the outset, and many here can think about periods of overreaction because we didn't have that information. Other things that come to mind for me: establishing data systems that would provide a degree of transparency and contribute hopefully toward public trust by, presenting data. But there were gaps in that at the very beginning in the outset. And so those were things that I think are I hope will be a lasting change, as thinking about our scholarly expertise, prioritizing impact first and foremost, and then accelerating not only the rate that research and science is conducted, but then also thinking about, importantly, modes of dissemination and the long gradual process of attending conferences and writing scientific articles. All of those things we still need, but when we're facing a global pandemic, it's clearly we have to prioritize other forms of public engagement to get information out.
Thank you. I think we have Dean Boerwinkle next. Did I say that right or close?
You did. Hi, I'm Eric Boerwinkle. I have the honor of being the Dean of the University of Texas School of Public Health. And I'm not going to repeat what's been said, but I want to point out the importance of new partnerships that were formed between academic public health and government public health, between public health and healthcare, which have been traditionally siloed. And some of these partnerships, without COVID would have taken years of, to form, and a lot of lawyers. And we were able to form really new productive partnerships very quickly to respond to the emergency. But I picked this example because I want to pivot that the challenge that all of these panelists have now is, how do we take all these good things that happened in response to this emergency and now, build off of them? The world has a lot of problems in terms of chronic disease, behavioral health, violence. I could go on and on. And I think what would really benefit if we could take all of the good things that have come out of COVID, even though it's been a very difficult experience, and steer them to other problems, other public health problems in particular. I think we have an opportunity to really make a very lasting impact, and I think that's the challenge that we should all really rise to.
Thank you, Chancellor Koslow.
Thank you, Bruce. So I just want to second everything that has been said, but let me outline a couple of innovations that we made, and also a couple of issues that concern me. So one was creating easy access for self-administering tests. So we developed like a vending machine system, which actually made us really famous, and also one of the first wastewater testing systems, automated wastewater testing systems. So many of our innovations, when we put them together, the American Council on Education recognized us with the award for most innovative campus, which was actually nice. But what now concerns me is going in, many faculty were not supportive of online education. We turned on a dime. We did a reasonably good job, and maybe even better than a reasonably good job. Coming out, many faculty are again not supportive of online education. I thought this would have changed the tide, but somehow it has not. So that's number one. Number two, going in with faculty and the administration, the institution, there was an employer-employee relationship with actually more like a family, but we did not take care of personal, how should I say, constraints and needs. Coming out, we now have to deal with everybody's personal constraints, like immunocompromise, families not doing well, older parents at home, and somehow it is changing the dynamic of what the administration, faculty-student relationship is going to be. And are we going to be an institution, or are we going to be dealing with more personal needs rather than student needs? So anyways, I'm concerned about this, and I don't know what the answer is.
I think that's a great point, and we've seen that same thing happen with us. Which are we, an employer with people present, or taking care of needs? And I don't know the answer either. Dr. Mifflin? Oh, Ms. Mifflin, I'm sorry. I'm looking at it backwards, sorry.
If only I had a doctorate. No,
If only.
I'm a mere journalist. I'm the executive executive editor of the Hechinger Report. My name is Laurie Mifflin. I would just like to ask you to be a little more specific, Dr. Kozla, about what personal needs you're talking about that you didn't have to address before the pandemic and you do address now.
So, for example, before the pandemic, if you felt sick and didn't come to work, there was a way to deal with it. Now, post-pandemic, we are hearing a whole lot of reasons, and many are actually reasonable reasons, because we don't understand this virus. We don't understand the long-term or long COVID effects of this virus. So people who believe they're immunocompromised, they're wondering if they should come back to work or they should be teaching remote. And if the university has opened for in-person teaching, this creates a little bit of complexity as to how do you deal with this on an individual by individual basis. So we need to be sympathetic, empathetic, all at the same time, while also running an operation where the students are expecting us to be in person.
Mhm.
Laurie, I would add to that of people having special needs and a child that's not be able to go to school, an elderly parent living at home, that kind of circumstance, daycare not available. And also, I think it's still running deep, fear of this virus. And people, there is a group of our faculty and staff who greatly fear that they'll come back to work and get the virus and get very ill in spite of the vaccination. And of course, you can't tell them they're wrong because sometimes they're right. So I think it's a pretty broad set of reasons. Anyone have anything to add to that they're seeing at their institution?
I think the way to think about this, Bruce, is it has complicated the employer-employee relationship in ways that we had not imagined.
Yes. In fact, there have been times when I felt it was reversed.
Right.
I see Dr. Orlovsky had a comment.
Thank you very much. I'm Janice Orlowski. I'm the Chief Healthcare Officer at the Association of American Medical Colleges. I really am very impressed with the comments that have been made. I'll bring up four specific areas that we have some concerns about, sticking to the question on, what's changed or what do we see with education. First of all, what I would say is looking particularly at secondary education, we have seen a significant number of students who failed and lost time with online learning. And in particular, we have a whole host of students that we are looking at right now who did poorly with math and science in an online forum and will need to catch up. And so the question is can these students catch up? What's the opportunity for someone who's been in high school or in middle school, and what is their opportunity to catch up in science and in mathematics? And we do see that there's a inequity in resources. The second thing, and I think this might also lead to some of the comments that Dr. Koshla was making, is that we have seen that women have been disadvantaged, probably not specifically in education, but that women took the burden of being at home to help with either education of their children or to be home with an elderly parent, and that we have seen a dramatic and important shift of women workers. I know as we have taken a look at academic medical institutions across the United States, this is a common theme of how to help women physicians, women educators, women scientists to continue their career. The third comment that I would make has to do with, we talk about education and higher education, and in my mind, education and research is always linked. And I think that the pandemic solidly explained why you have to invest in basic science research. No one knew that 20 years ago, the work that was being done on mRNA and potential future uses of mRNA would have the tremendous benefit that it did. And so I think what we need to do is to understand, and as we continue to invest in public health, we can't forget that basic science research is critical for our future. And the last comment that I would make has to do with education of the public in science. My 87-year-old mother does a pretty good job of explaining what an mRNA vaccine is. And it's not because I explained it to her, but it's because she was able to read and to understand and to be able to put pieces together. And she, along with some coaching on my part, made the decision about how important it was for us to do the vaccine. And I think that is a positive aspect of educating the public on science. But we also understood how devastating a small cadre of individuals who were able to provide misinformation in a new platform that we had not dealt with before. How misinformation can be spread and really interferes with the public's understanding. So I think I will stop, but those are my 4 comments to add to my colleagues' thoughts about education.
Thank you. Chancellor Barish, you had something to add?
Thank you, Bruce. I'm Bob Barish. I'm the Vice Chancellor for Health Affairs at the University of Illinois. It's the largest and most diverse university here in Chicago. I oversee the 7 health science colleges, University Hospital, and 15 of our mile square federally qualified health centers. I just wanted to give a specific example, Dr. Jarrell. We all talk about interprofessional education, and we're all trying to do the best. And I would say it was very heartwarming to see our 7 health science colleges and our students come together to start the largest mass vaccination site in the city of Chicago. And it was great to see them all teaching each other how to give vaccinations. And before the pandemic, I can guarantee you that dentistry and applied health sciences may not have talked to each other as much. And just to see them all teaching each other how to give vaccinations and the synergy of the academic components with an academic health center was really heartwarming. And they also learned about aspects of the patients. When we first began to give vaccinations, I'm sure it was the same thing with other people on this call, many of them were 90 and older, and many of them started crying after giving the vaccination. It wasn't just that they were relieved we gave them the vaccination, but they were in their dwellings for almost a year, and they just wanted to talk to somebody. They just wanted to talk to somebody for 20 minutes to half an hour, and our students were there to listen across all the entities, and it was tremendous. And because of this now, Bruce, the university is putting forth for our Institute of Interprofessional Education will report through my office, and it was all began because of the pandemic. So it was great to see all of our students working together for the benefit of the citizens of Chicago and beyond.
Great, thanks, Bob. Before we move to the next question, I want to just make one other comment because Laurie originally asked this question. And if there were a distinguishing factor that I noticed, it was that each school was different. And what the educational needs of our law students were so dramatically different from our social work students, from our medical students, et cetera. And so although we speak sort of generically about, well, education was like this or like that, it was, but it was also highly sharpened in particular areas, which I would never have guessed. But in any event, why don't we move on to our next question if there's no other comments? I think Angela Gonzalez from the Phoenix Business Journal would like to ask a question.
Oh, yes. Thank you. Thank you. Yeah, I just looking back on everything, and we've heard lots of amazing success stories. What was most challenging as you were, oh my gosh, we're going through a pandemic and we're doing so many new and different things. What for each of the universities, what was the most challenging thing for each of you?
Who'd like to take that one on first?
I can.
Please do. Chancellor.
So, when this first happened, it's actually interesting. I flew back from India on March 10th, 2020. And I think March 12th, I closed the campus. And I had no clue how to create a communication mechanism that allowed us to communicate effectively with 40,000+ students, with 30,000 staff members, and all had to be done overnight. But somehow within less than a few days, I think we discovered the power of Zoom and how I could literally on Zoom run a meeting of 60 to 70 people literally every day and gain consensus on issues and what we were going to do for the next week or so. So to me, that was the most challenging thing then, but then it became so routine that I had to think a little bit as to what the most challenging thing was now. But that worked out really well. Communicating effectively with, several tens of thousands of people.
Dean Bowman?
Sure. The most challenging thing that I saw stemmed from just a lack of infrastructure and a lack of preparation to address a health issue like this. We've talked broadly about underfunding of public health in society within many institutions of higher ed. This kind of infrastructure was just non-existent. And as a consequence, we were establishing it in real time. And many of my colleagues in the School of Public Health were a part of this work for the university, but there was no plan for contact tracing. There was no plan for testing. As testing plans began to emerge, it only focused on symptomatic testing, but the important role of asymptomatic testing in informing us about the degree or extent of virus circulating in the community. Other forms of detection, containment, those things were just non-existent, and so I think we have had there was a sort of a steep curve, if you will, for the institution. And I think we've mostly made our way through, with some missteps here or there when you're starting from, near zero. But I think we've made our way through, and we'll be a lot better prepared on the back end if we're wise about it. And I say that with encouraging signs already at the University of Michigan, is that there will now be investment, and we're just sort of days before announcing it, but there will be investment in a new public health infrastructure that will have things like infection prevention and epidemiology unit, that'll have things like data surveillance, containment strategies, vaccine policies and those sorts of things, but it costs money to build the infrastructure, but it's so important that we have it, so that it's not really a matter of if, but a matter of when we're confronted, with subsequent waves of COVID challenges or new emerging infectious diseases, that we will be prepared to have a rapid response.
Thank you. Chancellor Barish.
Yes, Bruce, you mentioned it in your opening comments about an organized structure, unified command. And I know I was asked and my other colleagues to chair the task force to oversee the University of Illinois system. And there were 3 different universities. Urbana-Champaign's different than Chicago, different from Springfield. And so we had to set up an organized structure, an incident command, and deal with different issues. And we used the military model. Fortunately, we had a number of people, one who ran Camp David, and we were able to communicate with the board, because the board of trustees, this was new for them as well. So we came up with a color-coded reporting structure, or what they call in the military situational report, that could be easily viewed in 5 minutes to look at all the operational issues of the entire university. So that's something we learned that was a big challenge initially. We had never really all worked together. And I think, as Dean Bowman said, we've learned a lot. And I say this positively to everybody on this Zoom call. We at times we're learning to fly the plane, right? Building the plane as we're flying it. But I think we all made it through. And also, we learned a lot from our colleagues across the country and how they were doing things. So I think the communication with our colleagues also increased tremendously.
Dean Freed, I think you had a comment.
Yes, there were so many things that were the most challenging department, but building on what Dr. Bowman said, I think that, so I'm in New York, one of the first places to get really overwhelmed by COVID, and the medical care system really came quite dangerously close to topping out in terms of capacity, and sometimes did. And everybody pitched in, came close to killing themselves to support each other. And I know that was uniformly true across medical centers, but we all had the knowledge that because our country had been so slow to implement what Dr. Bowman was talking about in terms of prevention, that large numbers of people needlessly became ill. So this overwhelming of the medical centers didn't have to have happened. And knowing that, while people were needlessly infected and dying, was, I think, one of the most challenging things to handle for the workforce and for the public. At the same time, people mobilized to mission in amazing ways, despite knowing that. Everybody stood up, volunteering, supporting each other, recognizing that this was a moment for the public good.
Yeah, I have Dean Dalglish next, and then Dean Boerwinkle.
Thanks. I'd like to talk for a little bit about something not so much logistical, but a little bit more emotional. A continuing challenge that we have now that we're 5 semesters into this is our students. We did everything we could, our undergraduates in particular, we did everything we could to have open forums, and I was Zooming with them. If you're having a problem, please get back to us. We want to know how you're doing. And to watch their faces when they would sign in, and you could see that they were leaning up against the headboard in their bedroom with their laptop on their knees and trying to be real troopers. As time went on, they started turning their cameras off. And we were talking to the psychologists on campus, and they said, look, I know you find it disconcerting not to know who you're talking to, but they can't handle it. Just let them turn their cameras off and you'll get used to it. Now, of course, the last year when we were pretty much fully on campus, one thing that in dealing with our student affairs folks, they've been telling us, you're not imagining it. This year's class coming in is emotionally and emotionally and psychologically they're acting like 16-year-olds instead of 18-year-olds. So in addition to losing the academic preparation, emotionally, this generation right now that we're dealing with as freshmen and sophomores, they're a lot more fragile than I ever remember them being. And for the first time, the deans were comparing notes. We are having students, we told our faculty to show a little bit of grace when you were all online. Well, now the students are coming up to us, and assignments we would have given 5-10 years ago, they're coming up and saying, I can't do that. Like, well, no, you can, you can do it. No, you don't understand. I'm not going to do that. Our Student Government Association had a vote. They wanted to give students the ability to declare themselves mental health days unilaterally without getting a doctor's note 12 times during each semester. And I understand where some of that is coming from, but for us, I think it's going to continue to be a challenge, just trying to figure out how to deal with this generation as they come through the class. I worry about them all the time because they're not at the same level my students were 3 years ago.
Fascinating. Dean Boerwinkle.
Thank you. I think I'd like to refocus the conversation a little bit away from what was the biggest challenge to what will be the biggest challenge. You know, humans and leaders and elected officials have very short memories, and the public thinks COVID's over. A lot of elected leaders think COVID's over. So the investment that's needed in public health needs to continue. And we need to think about how to make sure that our states and federal government work to, to continue to invest in public health infrastructure, public health education. I worry a little bit that, they'll move on. I watched post 9/11 with a lot of investment in emergency response and terrorism response. A lot of universities build an incredible infrastructure, only to watch the funding and the interest in the topic, sort of wither away over a relatively short amount of time. And those units then were dismantled. And we can't let that happen in terms of pandemic preparedness. And Texas, it seems like Michigan is investing a lot right now in infectious disease and pandemic preparedness. And we need to make sure we continue to educate our elected officials of the importance to sustain that investment and thinking about the sustainability of all the lessons that we're talking about here. They're easy to quote sell during a public health emergency, but they're harder to sell long term in terms of long-term investment in infrastructure, which I think is what we need to be doing.
Thank you. Dean Freed.
So I think I already commented, but I would add, I would second what Dean Boerwinkle just said. I think there are numerous reports that have been really thoughtfully developed in the aftermath or even during the pandemic about what we have to do to invest to protect the health of the public for the future. With the knowledge that we have that a lot of prevention could work at scale if we did that, as well as investing in better detection and strengthened response. But it requires perhaps conversations like this and continuing to motivate for long-term investment, because the rates of pandemics will continue to increase, as well as a host of other emergencies arising, for example, from climate change. We need the infrastructure, we need the public health workforce and a revised public health system to be able to respond to.
You're on mute, Dr. Jarrell.
I think I have Dr. Orlovsky next.
So one of the things that we do in medicine is we do something which is called a root cause analysis. And we do it after there's a catastrophic event or untoward event. And I would say that as a nation, we need to do a root cause analysis. As I sit down and reflect on the early part of the pandemic, we did not have sufficient PPE in order for all students to be able to continue to participate in clinical care. We, didn't have a vaccine. We were slow to respond. There are just a number of lessons that we need to learn. And in a root cause analysis, you take the time to go back and say, what did we do well and how do we continue it? What did we do poorly and how do we continue it? And it becomes a very important document for medical institutions to try and change the future. And I would say that we need to do a national root cause analysis. We did some things very, very well. We did other things very poorly, and we need to learn from them. One of the specific issues that I want to bring up is the nursing home industry. And the nursing home industry is an industry that has been in the corner of our, sort of in the corner of our community. And we got a peek into some issues when there was hurricanes and flooding in Florida, and nursing home staff and residents did not have sufficient plans for loss of energy or needing to leave the institution. And as we take a look at nursing homes now, what we understand is that the infection control standards that we use throughout the healthcare industry somehow are not firmly established in nursing homes. And so that's an area that we are going to need to spend future time on. And then finally, to Dean Boerwinkle's comments regarding the need for investment, and hopefully with some kind of a national assessment, we don't lose our memories of what needs to happen. Besides the investment in public health, what I would tell you is that most healthcare institutions right now have a very precarious financial status, and it is likely going to take a minimum of 5 years for our healthcare institutions to get their feet firmly planted. As we take a look at it, it was not only, it was COVID, it was the change in COVID, it was the additional expense, but what we're seeing is a 35 to 40% increase in labor costs right now. And everyone knows how difficult it is to recruit and retain individuals. And so we are going to see significant shortages in workforce issues. So the financial, aftershocks of this pandemic have yet to be felt.
Thank you. I think we got Chancellor Kosla and then Christy, and then we'll move on to another question. So Chancellor.
Thank you, Bruce. So early on, I talked about the changing relationship between the faculty and the institution. I want to second what Dean Dalglish has talked about. I think the same thing is happening between the students and the institution. And we are just beginning to see a level of activism that we have never seen before on issues that 3 years ago would be irrelevant. So for example, if you have a cold today and you cannot come to class, 3 years ago, it'd be fine. Today, people say, no, I want the instruction to be done in remote because I'm disabled for that day. And I need you to deal with the disability. I think we are seeing a fundamental redefinition. And my concern is that we don't understand what this means, how to manage it, because I think this can easily change a lot of things for us. And the final impact is going to be not just on the education side, but financial also. But people are expecting way too much from an institution right now for which we are not funded and for which we don't charge anybody anything.
Thank you. Christy Roski, are you here?
Yes, I'm here. I just wanted to briefly, just briefly comment on a couple of the previous comments. And I'll say this with the caveat that I'm not a university administrator. I'm only a professor. So I have a slightly different perspective. And part of my role, I think, on this call today is I study misinformation. So to the extent that the information environment is important in all of this, a comment was made a little bit before about, our memories, right? And some of our memories about this pandemic have been politicized. And some of the places where we live, the pandemic has been greatly politicized. And that has impacted not only how we've collectively responded, but how we're seeing some of our students and our faculty respond. And so just wanted to make the connection that some of the rebuilding or continued learning is how do we help people deal with this information environment wherein they're getting bad information, they're being misled by experts, or maybe experts with air quotes around them. It's kind of both. And how can we help people find the evidence-based information that they need to make decisions that are going to help us for the next time, or as we're actually continuing through a pandemic, which is very much still going on. And so connecting interdisciplinary connections between folks in the medical and public health fields and other types of communicators and information providers, so that we can make sure everyone has the best possible information, and recognizing what a burden it is for public health and how underfunded it is, and how we can connect. I'm in a journalism school, for instance, and what we can do across the university to make sure we are honoring expertise and kind of teaching what expertise and credibility and reliability and all those things mean, and that we're helping people get the best possible information, even when our university systems are existing in maybe larger state and federal systems that aren't helping us in those respects. So,
thank you, Angela. I have one more pedestrian answer to your question about what was going to be difficult. I thought it was going to be very difficult at our university, where we had very strong schools, each highly ranked, each seeing themselves as somewhat independent of the university, each seeing themselves as in charge of their own school. I thought when it came time to pull them all together, it would be very difficult to get consistent policies, procedures, decisions, etc. But in fact, that's not what happened at all. It galvanized people together in a remarkable way. I would have never guessed that would happen, but in fact it happened. So that was nice to see. Why don't we move to another question? I see Andy Fisher has a question. Andy?
Yeah, this has something to do with what Eric Boerwinkle was saying and Christie's comments. I am a retired correspondent and producer for NBC, and I'm interested in what the medical professionals thought of the way the media handled the pandemic, and how we could have done it, how they could have done it better. I have my own ideas about this, but I'm interested to hear what you have to say.
Well, there's a good one. Who'd like to weigh in on that one? Say, Dean Dalglish, that's your expertise, isn't it? The media?
Yes. It was a very, I think some people did a magnificent job, and others from news organizations, largely television, that I would not consider to be news shows, but rather talking head shows. I think they did great damage. And and unfortunately, this got politicized. We also had a situation where the political reporters who were covering the White House and the agencies were kind of just blown out of the water, because they were dealing with covering a White House where on a good day, they didn't know if what they were hearing was the truth or not. And so the pandemic comes along, and what are you supposed to do? Not report what the President of the United States said today? It was very, very difficult. And then, of course, there were the more politicized than I would like evening shows and talk shows where I would not consider a lot of them to be credible. On the other hand, there was some absolutely amazing journalism being done. And I felt that I got the information that I needed. But going forward, I gave a high school commencement address yesterday. And one of the things I told the students was, promise me, when you go to college, you take a class in media literacy or search mastery. And if you're not going to go to university, make it a point to learn how to find credible sources, because we've got a huge problem there. I think there are people who are deliberately want to go after news that they identify with politically. There are others who just don't know anymore how to get good information. And as you all know, when we came out of college, you either got information from independent news organizations that were quite traditional, or from your teachers, or from people you trusted. These days, there's just so much garbage out there, and people are having a very difficult time sorting through it. So am I proud of how the media handled all of this? Yes and no. And those of you who have traveled in the last couple of years internationally realize that there's a segment of our population that is so remarkably ignorant compared to the way some other countries handled it, where there was more trust in institutions than there has been in this country for the last several years. So, you know, this is not a discussion about how to protect democracy, but it plays into it. And information, we all have to have we have to be able to trust in a common body of information if we're going to move forward as a nation. And I'm very, very concerned about that because I think some people just don't have the ability to do it. And I'm very interested in reading Christie's research about this.
Dr. Orlovsky next.
So I, like Dr. Dalglish, think that in some ways the media has done an extraordinary job. I think that there are very, very fine examples. I know many people who learn to go to a particular section in the paper to look at the the graphics that were there, to look at the hospitalization rate, to look at the infection rate. I just think that there are just many examples of very, very fine reporting and keeping the public up to date. I, like Lucy, believe that there were some areas that were terrible. And I call it the flat earth syndrome. And what I've seen in a number of cases is quotes from two people. Dr. Orlovsky, the distinguished professor from X, says the earth is round, and Dr. Professor from, distinguished Professor Y says the earth is flat. Both of these are, and the story goes forward. And we know that the earth is not flat. And so I don't truly understand why we present these as if these are optional, theories that people can take. And I would say that I believe that it is not it's not putting a personal spin on a story to be able to suggest that things are not supported by science, or someone's opinion is not supported by science. And I would say I only have seen this recently in two cases. One is that there has been a very noticeable intent by the media whenever there's a comment about the 2020 election being that there is some voter fraud, which has not been proved. And you actually see that statement now in many medias. And I'm just beginning to see that as well with some of the ivermectin and other. And I think that I think good journalism requires us to call out when two supposedly experts, and again, I'll put air quotes around one of them, are giving these types of opinions. One that is based scientifically, and one that has no basis in science. And we just need to have stronger background research that helps to distinguish that in an article.
Dean Freed.
I very much appreciate the comments by Dr. Dalglish and Dr. Orlovsky. I'd add a couple of other thoughts to theirs. One, which was quite interesting and I think useful, was that I saw a significant turn to universities by the media to provide objective and factual and leading edge reporting to help people understand what was going on, to predict what was going to happen, to critique or suggest what was needed. I'll give you one metric on that. Our school of public health has less than 300 full-time faculty. Our faculty gave over 35,000 media interviews in a 2-year period because of their commitment to educating the public, not because they were dying to not get their other work done. But that was a substantial commitment on their part, which I imagine is echoed at other universities. But it also reflects a recognition of the important value where universities could step in to counter some of the misinformation and fill in a lot of the missing pieces. And I think that was very important. The other thing I have concerns about, though, is that there were a lot of leads that never really, at least to what I saw, were adequately front and center. For example, the number one point in a pandemic is that we're all in this one together. And opting out is not really an option. So it's an issue of our concern for each other and the social compact for society. And there really was not much leadership from our political leaders on that, I would say. But there was also not enough reporting on the importance of that. And there were a lot of assertions that were under explored and refuted, like assertions that health and the economy were separable, that we should just move on from being worried about the pandemic and get the economy up and running. Those things I think really needed a lot more leadership to tackle.
Thank you. For the audience, I want to remind you that we're looking for your questions, so please keep them coming to us. I wonder, since Dr. Dalglish laid out some bait in front of Dr. Reski, any comments?
Do I have any comments about what Dr. Dean Douglas said?
Yes.
Well, I mean, I guess I agree with everything that she said, and the following comments in terms of the good and the bad of the reporting. And one of the key conflicts, I think, is that so much mis and disinformation about this pandemic has come from elected leaders or other people with expert credentials. And to the point about, are we meant to just stop reporting on what politicians say because we know that to be inaccurate? That's a real conundrum for journalism. And it's certainly something we talk about a lot with our students at the Cronkite School. I'm sure every journalism school is talking about that, and rethinking some of those norms about who our sources are and who our experts are, and what constitutes an expert, and how to qualify information that comes from people. I just think of when as a personal example, when our governor said that we could not mandate masks in state universities. How do we handle that, right? How do we report on that? How do we react to that? I can't speak to how university officials reacted to that. But as a professor and an employee and a person who studies information, these are just pretty new questions for journalism. And I think it's easy to sort of say, oh, social media and bad people want to put a lot of junk out there, but also people that we traditionally have been our primary sources for a lot of journalism are also putting a lot of junk out there. And it changes the nature of how reporters do their jobs, which also then changes the nature of how journalism schools talk about that. Just to say some of the things we're doing to address some of this is we do actually now have a degree in digital media literacy at the Cronkite School, a curriculum that I helped develop. So we are offering a 4-year degree in these kinds of areas, or this topic. We've created a free online class that's meant for adults, like the general public, so that anyone who's not a student in an institution can learn more about media literacy. So some of this is just trying to educate people on all fronts, but it's a tough battle because we only have so much reach, and some of this information has a much greater reach than we can educate to. So I don't know. I guess those are my comments.
Yeah, of course, one comment back to Andy would also be, since when did I get my medical advice from the media? And of course, part of what happened here was that people lost access to trusted providers for a variety of reasons, or they weren't hooked up with the system. And so that was their source of advice, that is the media, as opposed to a physician or someone else in the know. That's also an important part. Go ahead, Christy.
I'm sorry, you just reminded me of one other thing, which is sort of two other challenges the media faced. One is that, there are fewer journalists and there are fewer science journalists that exist. There's fewer people who have a beat that are, that's their beat. And so when you have this pandemic hitting you, you have general assignment reporters who don't understand the science, trying to report on something that in early days, the scientists don't even understand, right? So it's how you communicate something that's unfolding. And then the second piece of that is, I lost the thread. So I'll just stick with that one piece.
Okay, well, you'll get back to it. I have Dean Bowman, one last question, and then we'll move to a new question.
Yeah, thanks. And I just want to maybe compliment what a lot of others have said and talk a little bit more just about the consequence of some of the things that you've described. And as many on the front lines of public health at the national, state, local levels, those within our academic institutions have tried to step in to help to educate the public. One consequence of the sort of the political environment and the poor media coverage is the sort of backlash and sheer vitriol that they've experienced. And, just by way of example, someone from a public health department in the state of Michigan teaches a course in my school, and he had to join virtually from an undisclosed location because of all the threats that he was receiving. And so, there are real consequences, that I just wanted to point out. And then the other troubling aspect that comes to mind, it shapes behaviors and actions that run counter to our efforts to try to keep the public safe and healthy. And we've seen that through mask wearing or non-compliance with mask wearing or resistance. But vaccinations are, certainly probably the biggest place that we've seen issues that are lingering issues that back a lot of the hesitance that we've seen. And it takes a lot to combat that. It's not just as though arriving with sound information is enough to combat a lot of the misinformation that's portrayed through various media outlets. And so we do have a number of people working in our school on this kind of problem, but it takes a lot of time. You have to have messages that are tailored to individuals and their context and their beliefs. It takes a while to gather that information and then to figure out, modes of communication, sometimes things like personal text messages, notions of, Linda mentioned, we're sort of in this together, and that notion of protecting people that we hope would resonate. It turns out for many, that's not sufficient reason to change behavior related to vaccines. People care about maybe protecting a mother, a father, grandparents, and do you have to come out with very specific and tailored information to try to move their behavior? There's a term that we use, fence sitters, for those who are a bit in the middle, but it does take extensive effort along these lines and things like motivational interviewing to try to move their behavior in a more safe and productive direction.
Great, thank you. Good discussion on this question. We've got another question from Susan Greenberg. Susan?
Thank you. I'm a senior editor at Inside Higher Ed, and I really appreciate you all taking the time to do this. It's very generous of you. I wanted to return to something that Dean Dalglish and Chancellor Koshlet touched on, which is the mental health aspect of all this. We've all written and read a lot of stories about how that there's sort of a second pandemic on top of COVID, which is mental health, particularly among young people and college students. And I'm wondering what sort of lessons you've learned with regard to mental health going forward, and perhaps more pointedly, how do you navigate that sort of delicate terrain between being really supportive and concerned about students who are genuinely struggling with mental health issues, and also maybe giving them a little push when they can in fact do the assignment and don't need 12 mental health days per semester or whatever.
So
Lucy, you want to go first? You want me to?
Yeah, please.
You know, I wish I knew the answer to that. It's something we struggle with every day. It was, I had a parent orientation today for incoming freshmen, and it's something I tried to talk to them about. It was like, you know, stay on top of what's going on with your students. We'll try to do it as well, but let them come here and have a college experience, and we're all trying to spot danger, right? Really bad stuff. I think what we've been working on is trying to teach their classmates how to identify certain behaviors and comments and sort of be an early warning system. And we've tried to make everybody feel like if something is really, really bothering you, please come in and we will talk to you. The other thing is, and you all know this, come Thanksgiving time, that's when you start seeing the cheating. Why do they start to cheat? It's because they let things get away from themselves and they're crushed at the end. And nobody ever goes to college thinking, hey, I'm going to be a cheater. But they let things get away from themselves and they get backed up, and so they're tempted to do it. So we just over and over and over and over again encourage them to talk to each other and to talk to our faculty. And if they don't feel like they can talk to their teacher, to come in and talk to one of us or one of our counselors. It's really, really hard. I've actually been kind of surprised at how much other students have been helping us identify problems, because they can kind of tell when somebody's not behaving normally. And they are increasingly coming to us and saying, you know, I really think you need to do X, Y, or Z, or, you know, this story that the class is working on is very stressful and it's triggering some students. And can you get a counselor to come in and talk to us about how to handle covering this story? They are much more, this generation is much more comfortable telling you when they're having a mental health crisis. But at the same time, the ones who really need it are often the ones who don't speak up. I worry about it every day.
So let me frame what we're doing at UC San Diego. So we saw this coming about 6 months ago because we were seeing this in multiple different ways. And just this observation that 2 years of no social contact at age 16 was going to lead to lack of understanding of how to deal with each other socially was not rocket science. I mean, I'm not a psychologist, but this is not rocket science. So then you ask yourself, what is it that's limiting us right now? In mental health, the issue is of one-to-one counseling, one-to-one psychiatry. So the rate limiting effect, the rate limiting situation here is human manpower, person power, right? So there's not enough counselors, there's not enough psychiatrists. And we've known this problem for actually several years now. So what we're doing is two things. We have a completely vertically integrated strategy now, which goes from something as simple as my mother yelled at me, I'm not feeling well, to I'm on the ledge, ready to take a dive, help me out. And so we are building this strategy around what is called the mental health and wellness wheel, multiple aspects of mental health and wellness. We are creating multiple wellness zones on our campus, and we are building an 80,000 square foot building that integrates all of this in one building with all the counselors and psychiatrists in that building. But most significantly, we have started building an app that amplifies the one-to-one counseling to 50-to-1 counseling now, peer-to-peer counseling. And our chair of psychiatry, who's a leader in this area, Jeff Daskalakis, is leading the creation of a mental health institute that integrates all of this. So this is going to be a work in progress for a couple of years, but I can tell you this is going to be a role model for how academic institutions should be dealing with mental health in an integrated manner and not just putting more counselors or more psychiatrists onto this issue, because that's not going to solve the problem. We don't have enough. We're also building a master's program in counseling, by the way, so that people can do counseling more than psychiatry.
Chancellor Barish?
Yes, thank you, Bruce. And Susan, it was a great question. Of all the uses of technology during the pandemic, we found that telehealth was the best. In fact, 97% of our patients kept their appointments because of the use of telehealth. And so we used it for our students. And I wouldn't forget the providers here. Our providers really, as you know, you've all read about, about the burnout, really significantly affected our providers. And what we learned, just as we put clinics in the community so that we can reach out to the community, our Department of Psychiatry began doing rounds on the hospital so that the nurses and the providers can come up to them. It was the first time they actually went into the hospital, did rounds, and asked the providers, would you like to speak to us? We reached out to them. But we found that telehealth, and now we were continuing it, was really a major component of how we dealt with the mental health issues. And we're still obviously dealing with that with our providers. So I just wanted to mention the providers as well.
Thank you for that. Dean Freed?
So I appreciate the question. We are constantly trying to figure this out, and I don't want to suggest that I have the answers. I think we, as well as all the other institutions here, have put a substantial amount of increased resources into counseling for students and supports. But in talking to students a lot, and courses I teach and what I hear from them in the last year, my sense is that there are other things we also need to figure out how to attend to. So I can't tell you how many conversations I've been in with students at the graduate level who feel, and the undergraduate level, who feel despondent about the state of the world, who feel angry about climate change and feel abandoned by older people. That level of feeling abandoned is compounded by the free-fall experience of COVID and all of the other things people have mentioned in terms of successful personal development. But I think there are other components here. And the rates of loneliness in young people skyrocketed. So I think we need to think about how to build other bridges to other people, compassion and empathy for themselves, but also for others, and reintroduce skills of building friendships. It sounds so basic, but and then I was struck in one of the classes that I taught during the pandemic, and we had to retool a final project because we couldn't meet in person abruptly. And so the project involved students, undergraduates and graduates, interviewing older people. And they felt like they were doing something altruistic, which really improved their sense of well-being, that they were helping all these older people stuck at home feel, not be lonely. But they had to write essays about it afterwards. And they uniformly said that they thought they got the most benefit out of it because they got the reassurance from the older adults that, they would survive the life experience of having been through worse, the altruism of older people that they were staying home to protect others, and a new friend. And every single one of them reported that they came out of the experience feeling safer, more able to cope, having backup, having a connection that felt almost like a lifeline for them. So I don't know the answers, but I think we need to think about these other dimensions as well.
Important ones. Any other responses to this question? If not, then Rick Seltzer from Higher Ed has a question. Rick?
Yeah, Rick Seltzer, senior editor with Higher Ed Dive here. Thank you all for a great conversation. I've got about 6 jotted down here, 6 questions, but I'll only ask one right now. The comment was made earlier in one of the discussions about mental health, I believe, about faculty members and employees and effects there. And so I want to broaden a question there a little bit and ask you if you're worried about retention, or to what extent you're worried about retention, either within your institution or losing folks, not just to other universities, but out of higher ed generally. And I would extend that from staff to faculty and all the way up to administrators and leaders, because we've seen a fair amount of presidential turnover, it seems to me too. So do you have strategies for retaining talent and or simply what kind of concerns do you have for that at the moment?
Anybody want to talk about that?
Can I take
Please,
that?
please, Chancellor.
You know, we are, actually, that's a great question, Rick. So we are facing a very significant challenge. If you look at the changing relationship between the employer and the employee, then you look at the power of Zoom and how some institutions think that they can hire employees in like states with where the cost of living is lower, right? And have people do remote work, because that's what the 2 years taught us, that much of what we thought had to be done in person could be done remotely. You put the two together, and now and then you add the inflation factor to it. So now the compensation's higher, the cost of living is lower, and you're working remotely. I mean, you got 3 of the best deals for the employee and 3 of the worst deals for the employer. Because if you're the employer, I mean, all these 3 things are working against you. If you're the employee, it's for you. So you can see the dynamic balance, which would hold employers and employees in equilibrium, has now changed completely in favor of the employee. And we are seeing this, right? So San Diego, which was the lowest cost of living amongst the 3 big cities in California, is right now the highest cost of living, partly because a lot of people have moved to San Diego, partly because even in the UC system, San Francisco, UCLA, Davis are hiring people in San Diego remotely. We have a $1.7 billion research portfolio. So for example, we have a lot of fund managers, people who understand how to manage NIH contracts. Lo and behold, I lost like 20% of them overnight because other places need exactly those people. So we are seeing that a lot in staff. I'm not seeing that as much in faculty, but I think it's just a matter of time where the faculty member wants to live in Paris and teach remotely. It's coming. It's not there yet.
Dean Dalglish?
Yeah, I was waiting for this question because it's a really good one. On the faculty side, a lot of faculty in journalism don't spend that much time on campus anyway, because they don't have to be in a research lab. So they've got a really good deal. I was actually able to recruit a couple of people mid-year from other universities because they had personal reasons to want to be in an environment where everybody's wearing a mask. And at the University of Maryland, the rule was if you are in a classroom, you must wear a mask. And I had people mid-year calling me and asking if I needed anybody, because they were scared to death about their own health or somebody in there. So I used it as a recruiting tool, and I picked up a couple of really outstanding professors. On the other hand, we've been allowing our telework policy on the staff side allows you to take up to 2 days a week remotely. We had planned to lift that for this coming fall and go back to, the standard will be 1 day a week. But here's the problem. We're inside the Washington Beltway. The federal government really hasn't gone back to work yet in person. And so we're starting to hemorrhage people on the staff side. It's like, why would I want to pay for all that gas and be in a potentially dangerous place when I can work at home? And for the federal government or any one of numerous companies out there. So we're spending the summer trying to figure out how we're going to handle this on the staff side, because you can't just say everybody gets to work from home all the time. because we're a campus and families are paying for an on-campus experience. They're paying for services from these staff people. So we can't just abandon the campus. But meanwhile, we know we are losing people because they're taking jobs where they don't have to show up in person.
Dr. Orlovsky?
So before I make the comment I was going to, I'm actually going to comment to Lucy. And my thought is that there are going to be people who choose to be on campus and students who choose to be on campus and students who choose not to. And I think this is just another reckoning that higher education is going to have to deal with, which it has been, moving towards. And the idea of online and online degree programs is going to be very, very attractive for some people. And I think that there will be a shrinking in the number of campuses that we have. And not everyone sees the value of that on-campus experience, although I do believe that there is value. The comment that I was going to make about the workplace, Rick, is that I think that this is another change in the employee-employer relationship. And that is, before it was, I will treat you well, I will give you a job and you will be paid X amount of money and you will get, some fulfillment from that. And now I think that we really need to take a look at more substantial issues. For example, how is the individual valued at work? Do they feel that they're valued? What is the makeup of the team? What's the culture that you have? Is the culture within your institution supportive? And do people want to spend some of their time there? And I think that what happened with COVID is that it gave everyone sort of a chance to have these existential conversations with themselves about what am I doing, where am I going, how am I spending my time, and am I valued? And people right now are seeing that they have opportunities. I know, if we take a look at academic medical centers, we are now seeing a number of nurses who are saying, either I need to take a break right now, and I'm using nurses, but I could put in other individuals. Either I need to take a break right now, or I'm going to go and work not in an ICU where everything is crazy, but I'm going to go home and use my skills and my nursing knowledge to take an insurance job or to take something that I can do at home. And so I really do think that people are having these sort of these value decisions that are going on. So what do we need to do as employers? I think that we do have to figure out how we can balance people's personal lives and their employment. I think we have to help them with these decisions. I think we have to work very hard on the culture that we have. I think that we do have to demonstrate the value of their profession and the institution and what we can do with them and for them and for their personal growth. And I think the employer will need to take on many more, what we used to refer to as sort of these softer aspects of employment. And that's the only way that we're going to be able to keep people.
Thank you. Dean Bowman?
Yeah, my comments really echo many of the things that have been expressed. On the faculty side, we always worry about retention. The things that we've seen in the area of retentions, I'm not sure they're spurred by some of the things that you alluded to in your question, Rick, but many institutions of higher ed went through a period of hiring freezes, and then those were lifted. We're doing a lot of recruitment at our university, as are other institutions, and so I think there's just some normal movement in that regard. On the staff side, though, I think I do think it's different there. I think that, and we've we've done some surveys for our employees just to try to gauge the sentiment of the staff, and we didn't limit it to staff. We also asked students and faculty as well. But it's clear people want flexibility, and I think after growing accustomed to having an increase in flexibility, people really value that, and people want to ensure that there's some element of that, and as they think about their future. From and the employer side, there are a couple of things I would say to that. There's one, we ask about things like productivity. Most people, their self-reports of productivity, and most people feel like they've been able to be productive. I worry, what's not captured by self-reports of productivity, right? Maybe you can make it through your inbox and get a list of things that you wanted to do that day done. But are there other things that may have arisen if you were around and in your office on those couple of days that week, or with the students that may have come by and saw a closed door who never returned? So that sort of thing I want to make sure we keep a close eye on. And then, just really making sure that we maintain the highest of standards with respect to mission. And that's on the education side, the research side, as well as our service or practice missions. And then the other thing I'll point to, just as an open question, as we try to think about a more normal rhythm of in-person activity. Our classes are back, but still there. I wouldn't say that we've so kind of resumed a normal rhythm like we saw in the fall of 2019. But what types of work functions operate pretty smoothly, and which things do not, which things leave something to be desired? And so, my gut tells me that there might be things like interdisciplinary collaborations and innovation that are much harder to achieve if we're relying on virtual means, whereas other things, again, kind of the straightforward things where getting through one's inbox, maybe a closed door, or being within one's home might actually increase productivity rather than decrease it.
Thanks, Dean Bowman. I agree with a lot of those things, and creativity and innovation is hard to measure in anybody's book, especially if you're at home. Rick, the one other comment I would make is that we're seeing faculty and staff who during the pandemic moved. So they weren't just working from home, they changed their home. And sometimes that home was far away. And sometimes the employment law in that state was different from it was in our state. And I know that's created our share of problems in dealing with that. How do you get the toothpaste back in that tube? Not so easy. And so I think it is a very complex situation right now. If I see no other answers, I think Andy Fisher had another question. We got time for one more. And Andy, I was hoping, in addition to asking your question, you would answer the question that you asked us initially about what you think of the media.
Well, I'm disappointed, and I'll leave it at that. My question is there general agreement that masks work, but mask mandates do not?
So
That's
can I?
a good one, please, Chancellor.
So there was a article on exactly this issue in New York Times, if I'm not mistaken, and they concluded that masks work, but mask mandates don't. And I tend to disagree a little bit, because even when you mandate masks, if you don't expect 100% acceptance, even if half the people wear a mask, that still is better than nobody wearing a mask. So I think the question, it was posed in a cute manner, but I think the conclusion was wrong. It made it look like if I mandate something, it doesn't work. I think error in this argument is when you mandate something and you expect 100% compliance, then compliance doesn't work. But if you mandate something and statistically majority of them follow the rules, then it works like a charm.
Other comments on that interesting question? Dr. Orlovsky.
I agree with Dr. Khosla. I live in Washington, D.C., and I can remember the first couple of months of the pandemic. There was actually a mask mandate that was put in place, including a mask for anyone who was exercising outside. I can remember looking out of my home in Georgetown and seeing someone running down the street with a mask and riding their bicycle, and they had a mask. My parents live in northern Wisconsin, and apparently there was a different pandemic up there because despite the fact that there was quite a bit of legal back and forth about whether there should be a mask mandate in Wisconsin, and there was eventually a mask mandate. No one wore a mask, and so I think this is a Tip O'Neill. All masks are local, is what I would say.
Dean Bowman.
Yeah, so I'll answer the question from like a local institution level. And at that level, I would also disagree with the statement. But I think the really important thing is how you arrive at the mandate. It's not just the mandate itself. And so the importance of engaging key stakeholders, inviting them into the conversation, ultimately leading to a decision with some transparency. So ultimately, I think what you need is not just the mandate itself, but high compliance, right? And I think that doesn't necessarily just come automatically from a mandate, but if you follow the right process to get to the mandate, you're much better positioned for success.
Okay, thank you. Dean Freed. You're muted, Linda.
Sorry. I agree with what Dr. Bowman said. I would say that mask mandates alone probably don't work. Mask mandates led by leadership, informing the public, motivating for shared responsibility, and where people understand what the benefits are and the conditions in which to do it, it works. But there are a number of things, as Dr. Bowman said, that have to go along with the mandate itself.
Chancellor Barish?
Yes, I agree with so many of the comments. I just wanted to say that some masks are better than others. And if you go into a hospital, right, and Janice is laughing, you'll see us all wearing at least a KN95 or an N95. Recently, the Surgeon General visited us here in University of Illinois, and he was wearing an N95 during his visit. So I just wanted to make sure there is a distinction, and that if you see providers, you'll see us trying to wear the most protective masks out there. Yes, there you go, Janice.
Which was the attitude that we took too, that it needed to be a KN or an N95 to really have merit.
Yes.
How about other comments? Do we have any other? Well, I think it's 8:51 by my clock. I think, Virgil, it'd be time to close down, don't you think?
Yes, I think it was a fascinating discussion, and I've been following the pandemic, but I learned an awful lot tonight.
Well, I think it underscores that we as universities, particularly the health science centers and public health, we've had a very different experience, I think, than the general population. And I think we've been very engaged. I know at our institution, we've been so focused on this topic, and it's not as simple as just getting people graduated. It is the mental health. It is all of the things that we do. And so I think the topic was a good topic, Virgil. Thank you for suggesting it. And I want to thank all the participants, both the panelists and our guests. And perhaps we'll have a comeback on this in the next 6 months when we have all the answers, which I'm sure we will, right? So any other parting comments? Well, thank you all very much for this most stimulating discussion.
Thank you.
So see you all later.